You have company. Acne affects almost everyone. It strikes nearly 85% of the population between the ages of 12 and 24. 40% of acne sufferers have breakouts severe enough to require medical treatment. Acne doesn't show favorites. Men and women of all races during adolescence and adulthood are nearly equally prone to acne. Location. It's a widespread skin condition characterized by lesions that break out on the skin. The lesions form as whiteheads, blackheads, or cysts because pores get clogged. The so-called T-zone of the face, the nose, the chin and forehead, are the most common areas for pimples to appear. The back is the second most common area for acne, followed by the neck, chest, and shoulders. Timing. Usually acne first attacks during adolescence, most often at puberty because that's when the body starts producing an abundance of an oily substance called sebum. Normally a good thing, sebum keeps the hair and skin soft and lubricated. But during puberty, the body produces too much. The excess oil clogs the pores and leaves the skin feeling oily. Puberty also triggers an excess production of follicle cells. Dying cells quickly build up and combine with sebum to form whiteheads. The oil and dead cell creates a breeding ground for bacteria that creates redness and swelling in the area, resulting in pimples. A bad image. Acne becomes a self-image difficulty for many people because it affects their appearance. Teenagers are particularly at risk as acne can cause feelings of reduced self-confidence and even depression. It causes some to withdraw from social interactions and others become angry and troubled. Most people find their acne has cleared up by the time they reach their 20s. Although for some it can last throughout their adult years. Treatable. The good news is there are many modern medical treatments for acne. The first line of defense is to keep the skin clean and oil-free. Do this by gently washing with soap and water twice a day, especially following activities or conditions that cause perspiration. There is a wide variety of medical treatments available, both prescribed and over-the-counter. For serious cases, a dermatologist is needed for advice about nutrition, lifestyle changes, topical medications, and antibiotics that fight the bacteria causing pimples. Don't just look in the mirror and cringe. Fight back. While acne can happen to anyone at any age, it is most commonly associated with the highly volatile teenage years. Many people will have acne outbreaks during their teenage years, and totally escape having any scars to remind them of the experience. Others, however, will be scarred, literally. If you find yourself in that situation, you'll be pleased to know that there are many options that can help you get the clear, smooth skin you want. One of the most effective methods is laser acne scars. Laser treatment is a method, performed by your dermatologist, which uses a tightly focused beam of light to remove the outer layers of skin around your scar while also encouraging the production of collagen. This way you will have a new layer of unblemished skin instead of an unsightly acne scar. Not everyone will see a benefit from this type of treatment. Your doctor will let you know whether or not you are a candidate for treatment. There are many factors that determine who might be a good candidate, such as your health, and the type and severity of your scars. Laser treatment is done at your doctor's office in most cases, and you will be going home shortly after the procedure. The doctor will give you a local numbing agent to numb the area that is to be worked on. The actual process consists of using a small, handheld tool that sends short light pulses into your skin right where the scar tissue is. Once the old damaged layer is burned off, your body takes over and heals itself, which will replace the damaged layer of skin with a new undamaged layer. Like most other treatment options, laser treatments has both its good and bad points. The good points are that it is very effective, even if you have pitted scars. The procedure doesn't require you to lose time at work or doing your other daily activities, and most people will see a significant improvement in their skin tone as well as texture. On the downside is the fact that this type of treatment is expensive, though some insurance companies will cover some of the expense. It also will require several treatments, just how many will depend on your unique situation. Your sessions will need to be scheduled over a period of several months, since you will need to thoroughly heal from one session before you can undergo another one. It's always nice to have options, and when it comes to removing ugly acne scars, you do. There are a lot of variables that will determine which option is the best one for you, and you should be willing to take the time needed, and ask the questions needed, to determine which option is right for you. If you decide that laser acne scars is the right acne scar removal method for you, you will want to carefully look at the credentials of the doctors in your area before you decide who you will trust to perform the procedure. Also, make sure you find out whether or not your insurance will cover the cost. Acne scar laser treatment stands out among all acne treatments in effectiveness. Acne scarring comes under cosmetic disfigurements posing psychological problems to the patients. It is notable here that most of these can very well be corrected using laser as skin resurfacing modality. Acne scar laser treatment involves using a light beam from a carbon dioxide laser. The latter vaporizes the upper layers of damaged skin at specific and controlled levels of penetration. The development of selective photothermolysis has caused significant advances in the use of laser technology for skin resurfacing. The improved technology has helped reduce residual thermal damage. By using shorter pulse durations of laser light, the minimizing of thermal damage significantly reduced the risk for scarring on the skin. The latest procedures involve an intense beam of light to destroy the skin tissue instantly. As of now, carbon dioxide and YAG laser reportedly offer best acne treatments. They are able to perform highly specific vaporization of tissue using powerfully focused light to precisely remove the skin layers. Thus they vaporize the ridges of scars and wrinkles and smoothing out the surface of the skin. Less than BR greater than less than B greater than best lasers for acne scar removal less than B greater than. YAG laser offers the best acne scar laser treatment. The benefit of YAG laser for superficial to moderate acne scar removal stems from the fact that this laser produces less thermal damage compared to other types of laser. The short-pulsed YAG laser has a water absorption coefficient 16 times greater than that of the carbon dioxide laser. The water in the tissue absorbs most of the energy of these lasers. That results in minimal optical penetration depth and thermal damage. The more limited penetration of these lasers into the skin triggers a histopathological improvement less pronounced than that of carbon dioxide laser. However, YAG laser shows potential as an acne scar removal treatment, especially in the treatment of mild to moderate superficial rhytides and scars. In fact, it is the best acne scar laser treatment for acne scars that are not very deep.